Okay, the next we're going to look at is a mild depression in a young man. So next scenario is mild depression in a young man. In this particular case, he has come in to see the GP, and of course you are the candidate. You're an FY2 doctor in a GP surgery. He has come in to see you with the insomnia. His only problem or main problem is difficulties falling asleep. And he has had insomnia for the last 3 months. Insomnia for the last 3 months. Okay. Now, in this particular case, what is the history? He got divorced 6 months ago. He has had difficulties falling asleep for the last 3 months. Okay, he goes to bed around 11 p.m. Okay, he will fall asleep, but then he wakes up early around 2 a.m. And once he wakes up at 2 a.m., finds it difficult to fall asleep again. During the day, he feels tired and sleepy. He lives alone. His mood is 4 out of 10. He is able to do his daily activities, but because of lack of sleep, his energy levels are low, feeling tired and sleepy during the day. A question he has, doctor, how can you help me? This particular patient, we can see the mood is low. We can see there's early morning awakening here, 2, 3 a.m. he's up, then he cannot fall asleep. Okay. And of course, the cause of the whole problem is a divorce. Yes, it didn't happen immediately, but for the last 3 months, difficulty falling asleep. So he may have a mild depression, and therefore the most appropriate treatment would be what? A CBT. So in this particular case, his main question, how can you help me, doctor? Yeah, explain. His mood is quite low. He's finding difficult falling asleep. Feels tired during the day, mostly because of lack of the sleep. Okay, but he may be having what we call a mild depression. Yeah, so the most appropriate thing would be to send him for counseling, what you call a CBT. Okay, that's what it would do for you. The rest of the things as usual. If he's, follow-up. If he's 30 years and above, you do a follow-up in 2 weeks' time. If it's less than 30 years, in 1 week time. Or for the leaflets about depression. Medications for now are not needed. Safety netting, you offer a crisis card. If he experiences any suicidal thoughts, there is a number on a crisis card that he needs to call anytime, 24 hours a day. Of course, this is part of the approach of the depression, which you did watch already, approach to depression. Okay, so it's only an added scenario to it. Okay, so CBT will be the most treatment in this particular case. Ask about his hobbies and advise to pursue the hobbies. Ask about drinking habits and if his drinking has increased, and offer appropriate advice. Okay, going out with family and friends, speaking to somebody else, family support, friends support is important than keeping everything within himself. Your safety netting is a crisis card. Any suicidal thoughts, there is a number to call. You're going to arrange a follow-up as usual and apply all the rest of the management of depression as we discussed.